Dietary interventions for heart failure. What you need to know. Diet plays an important role in the management of heart failure. Find out how the diet and other dietary changes can help improve your symptoms and quality of life. Enter the Dietary Approaches to Stop Hypertension Diet, a dietary approach that has shown immense promise in the management of HF. This comprehensive dietary plan emphasizes whole grains, fruits, vegetables, low-fat dairy, lean meat, fish, poultry, nuts, seeds, and legumes while minimizing the intake of saturated and trans fats. The diet's composition is noteworthy, as it is rich in antioxidants, micronutrients, fiber, and nitrates while being low in harmful fats. This unique combination of nutrients addresses some of the underlying pathophysiology of HF. It counters pro-inflammatory cytokines, reduces reactive oxygen species, promotes endothelial function, restores micronutrient balance, and fights malnutrition. What sets the diet apart is its potential for individualization through precision nutrition. It allows for tailoring dietary plans to suit the specific needs of HF patients. This individualization, when coupled with behavior change techniques, could yield positive results in HF management. Sodium and fluid restriction. When it comes to managing heart failure, HF, nutrition plays a pivotal role. Heart failure is a complex condition, and one of the key dietary interventions that can significantly impact the management of HF is controlling sodium and fluid intake. In this comprehensive guide, we'll explore the importance of managing sodium and fluid intake for individuals with heart failure and provide practical tips to help you or your loved ones navigate this crucial aspect of HF care. Sodium, a component of salt, plays a critical role in HF management. Excessive sodium intake can lead to fluid retention in the body, which places additional strain on the heart. For individuals with heart failure, it's crucial to limit sodium intake to avoid exacerbating symptoms. The recommended daily sodium intake for heart failure patients is typically around 2,000 milligrams or less per day. This limit is significantly lower than the average sodium consumption in many Western diets. To achieve this goal, consider the following strategies. Start by becoming a savvy food label reader. Look for the sodium content listed on food packages. Pay attention to the serving size and aim for foods with less than 600 milligrams of sodium per serving. Avoid adding extra salt to your meals during cooking or at the table. Instead, use herbs and salt-free seasonings to flavor your dishes. Opt for foods that are labeled as low sodium or no salt added when available. These choices can help you reduce your sodium intake effectively. Processed foods, including canned soups and frozen meals, often contain high levels of sodium. Whenever possible, prepare fresh meals at home or choose whole foods over processed alternatives. Tips for reducing sodium in your diet. Transitioning to a low-sodium diet may seem challenging at first, but with some practical tips, it becomes more manageable. If you use canned vegetables or beans, rinse them thoroughly before cooking to remove excess sodium. Eating with smaller utensils, cups, and bowls can help control portion sizes and reduce sodium consumption. Experiment with herbs, spices, and salt-free seasonings to add flavor to your dishes without relying on salt. Cooking at home allows you to have better control over the ingredients and sodium content of your meals. Fast food is often high in sodium. Limit your consumption of fast food and choose healthier, homemade alternatives. In addition to sodium control, managing fluid intake is crucial for individuals with heart failure. Excess fluid can lead to swelling, difficulty breathing, and increased strain on the heart. Here are some essential tips for effective fluid management. Consult with your healthcare provider to determine your daily fluid limit. This limit typically ranges from 1,500 milliliters, 6 cups, to 2,000 milliliters, 8 cups, per day. Measure your fluid intake over 24 hours to ensure you stay within your prescribed limit. Use a pitcher of water to represent your daily allowance and pour out an equivalent amount each time you drink fluid. Be aware that fluids come from various sources, including beverages, water, milk, juice, tea, coffee, soups, and even foods like Jell-O and ice cream. Sipping fluids slowly throughout the day can help you stay hydrated without exceeding your daily limit. It's not uncommon for individuals with heart failure to experience a reduced appetite. This can make it challenging to maintain adequate nutrition. Here are some tips to address this issue. Instead of large meals, opt for smaller, more frequent meals throughout the day to ensure you're getting enough nutrients. Make every bite count by choosing nutrient-dense foods that provide essential vitamins and minerals. Examples include whole grain crackers with peanut butter, fruits, and cheese, or Greek yogurt with berries. If your appetite remains poor, your healthcare provider may recommend nutritional supplements like Ensure to help you meet your nutritional needs. Eating out can be a challenge when you're following a restricted sodium and fluid diet. However, with some smart choices, dining out can still be an enjoyable experience. Ask for your food to be prepared without added salt and avoid using the salt shaker at the table. Opt for grilled, baked, or steamed dishes instead of fried items. Avoid high-sodium condiments and ask for low-sodium substitutions like oil and vinegar. Keep an eye on portion sizes and consider taking half of your meal home to enjoy later. Another critical aspect of HF management is body weight. Excess body weight contributes to cardiac remodeling, HF risk, and symptomology. Weight reduction, particularly in overweight and obese individuals, has been shown to improve cardiac function and reduce symptom burden. However, it's worth noting that the relationship between body mass index, BMI, and mortality in HF is complex. Some studies suggest that a modest amount of excess weight may be protective in certain situations. On the other end of the spectrum, underweight status, including conditions like lean sarcopenia, is associated with advanced HF and poor outcomes. Chronic inadequate caloric intake in HF patients can lead to sarcopenia and cachexia, increasing the risk of mortality and recurrent hospitalizations. Micronutrient deficiencies also pose a significant risk and are associated with increased morbidity and mortality. Healthy diet patterns, such as the DASH diet, offer nutrient-dense options that can potentially address these challenges. However, strategies for intensive nutritional support in individuals with HF and significant malnutrition require further exploration. Nutritional supplements have been a subject of interest in HF management. However, their effectiveness remains a topic of debate. Antioxidant vitamins like vitamins C and E have shown limited efficacy in clinical trials. Coenzyme Q10, CoQ10, has yielded modest results but remains a topic of ongoing research. Omega-3 supplements have also been studied, with some trials indicating a reduction in recurrent HF hospitalizations. The use of intravenous ferric carboxymaltose has shown promise in reducing the risk of recurrent HF hospitalizations. Incorporating evidence-based nutrition strategies into HF management represents a promising path forward. The DASH diet, with its potential for individualization and precision nutrition, stands as a compelling option. However, further research, including pragmatic clinical trials, is needed to solidify its role as a standard of care in HF management. In addition, healthcare implementation science approaches may play a crucial role in ensuring the successful integration of effective nutrition interventions into routine clinical care. The stratification of patients based on self-efficacy and systems that support self-efficacy will be instrumental.